Thank you for the introduction. So morning, everyone. My name is Xinning. I'm a PhD candidate from University of California, Irvine. So today I'm going to talk about public discourse on risks during a public health crisis. So this is a collaborative work between researchers from UC Irvine and Arizona State University and Purdue University. So risk is the possibility that an undesirable state of reality may occur as a result of events or activities. So the essence of risk is not that it's happening, but that it might be happening. So in crises such as natural disasters, wars, and infectious disease outbreaks, high risks can cause death, injuries, economic losses, and disruptions and chaos. So because risks are not necessarily happening, a related concept is called risk perception, which means people's interpretations, opinions, and judgments regarding risks. So why risk perception matters? Since risks are not something that actually are happening yet, individuals need to assess risk in order to make informed decisions. So in this process, risk perceptions plays a very important role in individuals and also the public's decision-making during crisis. And also, individuals' decisions may not only impact themselves, but also add up to a larger impact. So for crisis response teams, understanding how the public perceives risk can help them to understand what the public is concerned about and what information the public needs the most. Specifically, we studied the public's risk perception on social media in an emerging epidemic, which is the Zika virus outbreak. So emerging epidemic diseases are infectious diseases that have newly appeared or that have been known for some time but are rapidly increasing, which can cause severe impact such as death toll and disability on large populations. So risks in such crises are usually very complicated and especially challenging because there is a lot of unknown about them. When scientific knowledge is still missing, there is a huge uncertainty in these situations for ordinary citizens to make sense of their own situation. So what kinds of risks the public health authorities focus on when they communicate with the public? So let's look at two examples. Both of them are from Centers for Disease Control and Prevention in the United States website. So the first example is about Zika. We can see that when talking about the risks, CDC actually focuses on immediate and personal risks, so which are Zika can cause birth defects and group B strep disease to newborns. If we look at the Ebola case, it's very similar. So the authorities focusing on personal risks and introduce those personal level risk management measures. So, however, do citizens only care about personal risks, and are they just passive recipients of risk information delivered from authorities? In our study, we examined the public's risk perception of the Zika virus outbreak, including the perceived risks and perceived risk management measures, so which will shed light on these two questions. In January 2017, we collected nearly 1,500 threads related to Zika from Reddit. We then screened the data, removed the non-English threads due to our team's language ability. We then randomly sampled threads to code until we reached theoretical saturation. So in total, we coded more than 7,100 comments. We have a very detailed description of our methods in our paper, so if you'd like to know more, please check it out. Our findings include the types of perceived risks and also dimensions of perceived risks. So in this talk, due to time constraints, I will only focus on how social media users perceive the risks along two dimensions, and for each, I will only provide several examples. So the first dimension is from immediate to long term, and the second is from the personal to the global. Immediate risks are risks that may happen in the very near future. So for instance, one common immediate risk described in those social media posts was that the mosquito control measures implemented by the authorities may actually kill other species immediately as well. So for instance, this is an exchange between posters discussing risks of a specific plan to spray for mosquitoes in user one's community. So user one does not believe that official explanation that insecticide is safe for pets. So the user one was worried about his or her shrimp. And then user two states their understanding of the official policy, but also urges caution. So user two says, they are only supposed to spray standing bodies of water, but yeah, I wouldn't risk it. People also discuss the risks that might happen in a long run. For instance, in this quote, Redditor said that we don't know the future of these children affected by Zika. And working with critically ill kiddos every day has made me worry about any added risks. Even without the birth defects, there may be long-term effects. People also talked about how risk could also happen at a larger scale than beyond the personal level. For instance, this Reddit shared his or her concerns. Women who are in part of the world affected are already more likely to deal with social and financial inequality. Adding a disabled child to the mix is not going to help anyone. And I couldn't imagine this on the widened income and opportunity gaps. So users also actively discussed the risk management measures. So they commented upon existing measures and also brainstorm future preventive measures. So such discussion also ranged from what preventive measures individuals should take to avoid getting affected, to what citizens themselves should do collectively, and to what kinds of emergency response public health agencies and the media should provide, to what policies can be made. So these diverse measures ranged from individual to collaborative and emphasize both on immediate and long-term risk. So here is one example. So this user discussed collaborative actions that they could engage to fight against misinformation during this crisis. And people also reflected on authorities' emergency responses and advocate for improved response in the future. For instance, in this thread, many users similar to user one, which we listed here, criticized that emergency response of local agencies that killed millions of bees. They argued that the agencies sprayed mosquito control insecticide at the wrong time when the bees were out while the mosquitoes were inactive. So they also pointed out that notifying the public about the upcoming responses only via local town or city social media pages was not sufficient. To summarize, so our analysis of public discussions on social media reviewed two dimensions along the temporal and also geographic scale. So we can see that citizens not only care about their personal risks, they are also concerned risks at a larger scale and in the long term. So this multidimensional perspective can be a valuable asset to existing crisis response mechanisms in many ways. For example, it can bring in perspectives on long-term risk and management, altering the current model in which public health authorities usually only focus on short-term effects and risk measurement. Second, it can enable reflection upon both current and future risk management practices. The local and experiential knowledge reviewed on social media can complement the knowledge of professionals and augment professional risk analysis. For instance, citizens may possess useful information concerning their own community, as evidenced by the local citizens' criticism that agencies sprayed at the wrong time when the bees were out while the mosquitoes were actually inactive. So let's go back to the question we talked about in the beginning. So are citizens just passive recipients? As our study showed, they engaged actually in the practice of risk speculation. So they utilized the known facts, available authoritative information, and also personal experience. Building on this knowledge, they could develop their own risk speculations that are not yet acknowledged or considered by authorities. So the current dominant model of risk communication in public health is top to down. It's like the professionals convey the information to the public and persuade them to take preventive measures. However, as our study shows, citizens, they are not like purely passive. So risk speculation also shows that those ordinary people can also be risk communicators. They will adapt at using social media to brainstorm and speculate about risks and also risk management measures. So their risk perception may not be accurate or correct or do not align with professional risk analysis, but it's not necessarily or totally ill-founded. Rather, the reasonings are often grounded in their situated knowledge and experience that can also be valuable for public health research and practice. So our study highlights some opportunities of participatory risk communication where the public can be engaged as risk communicators so that public health authorities can solicit public views, understand what the public is concerned and interested in knowing, and the rationality and values behind their risk perception, and even investigate issues that those professionals may have overlooked. So however, we acknowledge that such an approach is not without challenges and may have to be carried out cautiously and gradually. For instance, it's very understandable that public health agencies, they have those liability concerns and they might act on social media only using very formal language to convey those very accurate information. So considering both opportunities and challenges, we suggest that there are several ways that authority may consider engage public in the risk communication and risk speculation at multiple layers. So first, public health authorities can passively collect, analyze, and evaluate empirical data about the public's risk perception by making use of existing public discourse on social media platforms. Like our study showed that social media data can actually reveal large numbers of citizens' risk perception. Second, public health agencies' existing website may be improved to support interactions with citizens in ways such as online forums or virtual roundtables dedicated to different types of diseases, similar to the idea of citizen science in encouraging public participation in scientific research. So lastly, social media platforms can also support like direct communication channels between public health agencies and also ordinary citizens so that the public health agencies can interact with the public on a very regular basis about risks and policy decision-making about risk management measures. So we are coming to the end of the presentation, so we would like to thank the reviews for their constructive feedback. We also appreciate the Associate Chair's guidance. Thank you very much for listening. I'm ready to take questions.
Okay, we have a few minutes for a couple of questions, if anyone wants to come forward. Okay, well, I have a question to start off with. I'm curious the extent to which, in the public posts, people were using statistics and quantified data that I imagine the professionals use a lot to assess risk. I'm just wondering, were people kind of saying, oh, here's this killer fact, or here's the statistic, and how much you saw that being mobilized in the posts you were looking at?
So I don't know whether I understand your question right. Do you mean that the average citizens and also the authorities are actually using like statistics to?
So in a lot of the examples you gave, people were using a lot of qualitative things about their own experience.
Yeah.
And I'm curious to how much somebody saw, for example, a fact like 2.5 million bees died, and then they used that to talk about risk. So people talking about risk more in their own terms, or are they appropriating statistics from other people, from other sources?
Yes, actually, so during our data analysis and also in our paper, when we actually found a lot of people, they cited sources from multiple places, like from media reports, and also from those local citizens' reports, like posts online, to talk about like how many cases there have been in a local area. So what, like how high the risk in that local area. So they kind of do that analysis based on a variety of information sources. And in addition, I think that actually there's a need for public health agencies to do like a big data analysis or survey, because that would be very helpful for them to understand what the public is concerned about. We published another paper in EMEA last year. We used like machine learning methods and also NLP methods combined with qualitative study to analyze the tweet data. And indeed, we found that there's a very large gap between what those authorities were tweeting and what the public wanted to know. So I think that approach can be useful if the public health agencies employ some kind of professional to do that big data analysis. Yeah.
Anyone else got a quick question?